Well, good morning, everyone, and welcome to Grand Rounds. It is my pleasure to introduce today's speaker, Dr. Donghyang Kwon. Dr. Kwon is an assistant professor of pathology at MedStar Georgetown University Hospital in Washington, D.C., where she also serves as the associate program director for both the APCP residency and the Transplant, Medical Kidney, and Liver Pathology Fellowship. She completed her APCP residency at Georgetown, where she was my chief resident, followed by a surgical pathology fellowship at MD Anderson, again, serving in a chief role. And then a fellowship training in transplant, medical kidney, and liver pathology back at Georgetown. Dr. Kwon has already developed a strong and growing academic portfolio in liver, kidney, and transplant pathology, as well as medical education, and she has already earned multiple awards as a teacher, mentor, and leader. I think given her successful and ongoing journey as an early career faculty, she is truly the ideal person to speak to us about the secret life of a junior pathologist. As someone very interested in following her footsteps, I'm definitely looking forward to hearing what she has to say. So, Anne, thank you again for being with us today. Please go ahead and take it away.
Well, thank you so much for the impressive introduction. Good morning, everyone. It's truly a pleasure to be here virtually with you. I put a picture of myself here. You can even see the freckles, only because I will be sharing this precious photo with me. This is I just wanted to, start by expressing my sincere gratitude for Dr. Park for this kind invitation. And, Dr. Park is a dear friend of mine, and we trained at Georgetown together. He's not only recognized for his outstanding diagnostic skills and professionalism, but you can see that he was known for a fashionista in our department. So we greatly miss him. Oh, and then here are the other junior faculty. They're actually at Georgetown working here. So my talk today may be a little different because, it's not a conventional surgical clinical pathology, but rather we are focusing on the education, and so that we can better understand those of us who are in the early phase of our career. So I really hope that this talk will spark some engaging discussions and inspire some ideas. And this is a small survey-based research that I did, and I wanted to share the results with you. So why junior pathologist? I think the transition from a trainee to being an independent pathologist can be exhilarating, but challenging at the same time, because, it requires a blend of knowledge, practical skills, and emotional resilience. And, some of the common challenges maybe like daunting workload, adapting to changes in the work environment, and assuming the legal responsibility of signing your name on the report while carefully navigating the efficiency and accuracy of case interpretation. But I realized that there's no published study on junior pathologist experiences, nor do we even really talk about them. So as noted in the CAP survey here in 2021, we are entering a strong job market where demand may outstrip the supply of pathologists. And I think this is why today we need to embark on this journey of understanding the secret life of junior pathologists. So here is the learning objectives. By the end of the talk, I hope we can accomplish three things. First, identify key challenges commonly faced by the junior pathologists in the early stage of their careers. We will explore issues such as diagnostic uncertainties, time management, integration of new technologies, and how to balance, between professional and personal life. And the second, discuss practical approaches that our senior pathologists can employ to support and address these challenges. We will highlight best practices, mentorship opportunities, and support system. And the third, describe proactive strategies that trainees can implement during residency and fellowship to ensure a smooth transition to independent practice. Ultimately, we want to use this information to improve the transition experience for junior pathologists and pave more sustainable and fulfilling career path for them. So even though the talk today is highlighting on the life of junior pathologists, this talk is to really address to every one of you from trainees, fellows, medical students to faculty. So how did we conduct the study? Well, first, let's define what junior pathologist is. So I'm just gonna call it a JPs once in a while. It's a little bit faster. So JPs are those who have been practicing independently for up to 5 years after completing any sort of postgraduate education, including residency and or fellowship. Then we decided to gain better insights into this topic by conducting an electronic survey-based study that included 16 multiple choice and free text questions. And the survey questions included questions on participants' demographics, challenges faced during the transition period, clinical and non-clinical areas in which participants wish the training program had provided more guidance on, and finally on wellness. So here are the results of the demographics first. The online survey was distributed to 118 recent graduates of 2 academic institutions. It was a combination of MD Anderson Cancer Center Fellowship Program and Georgetown University Residency Program. And of the graduates who received the surveys, a total of 39 junior pathologists have responded and participated. And the respondents were very diverse. It encompasses various age groups. So the main age group participant was 39.3, ranging from 32-year-old to 52-year-old. So that's a very wide range. And among the participants, about half is female and half, is male, and then about 6% not wanting to disclose. About 24% of the participants were U.S. medical graduates and 76% for foreign medical graduates. And most participants had been in practice for less than 2 years, so about 68%, so that right here in this group. We think the higher response rate was from the most recent graduates, maybe because they might be feeling more connected to and stay in contact with their respective training programs. And another possibility is the selection bias, as this group, particularly those who practice less than 2 years or less than 1 year, maybe they're the one who's experiencing these transition-related challenges more than those who practice a little longer. So they are more interested in participating in this type of study. As for the work setting, we have about 59% academic and 46% non-academic, so that would include community practice. And then the 5% they indicated as other, which was not further described. So I would expect maybe an industry or research-based setting. Now, this is a super busy slide with lots of words. But I just wanted to give you an overview of responses to free text questions about challenges faced by the junior pathologist. And, kind of reading through this lots of words, we were able to identify some keywords and group these challenges into 7 representative categories for analysis purpose. So we will be spending bulk of our talk on understanding these free text question results that were put into these 7 different categories. So category 1 was no challenge, so that's good. No challenge, perfect. But category 2, challenge with pathology reporting and communication. Category 3 is challenge with efficiency, case complexity, and workload. 4 is challenge with administration. 5 is challenge with independence. 6 is challenge with mentorship and work-life balance. And 7 is challenge with professional identity formation. Interestingly, so when these results were analyzed by work setting, there was no statistical difference per se. However, we noticed a pattern that category 1 to 4 were more commonly brought up by junior pathologists in non-academic setting, while category 5 to 7 were seen mostly by those in academic setting. So University of Minnesota being an academic setting, perhaps I wonder if our junior pathologists share some of our sentiments regarding some of these challenges here. Now let's dive into the details of these challenges identified by junior pathologists and see how if we can find some strategies to mitigate them. Now we'll just ignore the no challenge, but starting with 2 and 3. For the presentation purpose, I think we could put these two categories together overall as a pathology reporting skills. So based on the survey, participants mentioned that they had trouble focusing on clinically significant and relevant changes. Some survey participants indicated that benign entities can be more challenging to report, which may particularly be true for those who trained in institutions with cancer-heavy population, like cancer centers. So I could understand. And some had trouble finalizing ambiguous cases that require lots of descriptive reporting. And some had mentioned about efficiency and time management issue. And some of the solutions that we could offer is that, well, overall, by gaining experience in descriptive microscopic reporting skills and knowing when to let go of clinically insignificant changes can naturally increase efficiency and confidence. So it sounds simple, but not really. So how can junior pathologists obtain the skills of more descriptive microscopic skills and learning how to let go of certain things? Well, I think these skills, really starts early on as a training. Depending on the structure of the training program, I think many trainees may not appreciate what goes behind the scenes after the sign up, because many faculty are involved in peer-to-peer consultation of sharing and showing cases. And trainees may not realize the amount of time that the faculty actually spend perfecting the reporting, because pathology reporting requires careful selection of words and sentences to deliver clinically significant and legally protected wordings. So these are the recommended strategies to tackle the challenges. So for trainees and junior pathologists, I think number one, start by understanding that reporting skill really is an art and a skill that needs to be taught, practiced, and mastered. So while you are in a training, pay attention to the pathology reporting, which means you may have to go back the cases that are already signed out and then see how it was actually finalized. And also not just simply rely on the templates or AI system for efficiency. Unless your institution is asking you to use a diagnostic template, I think it's important that you practice dictating the reporting rather than just copying and pasting. And for faculty and senior pathologists, please try to engage trainees in peer-to-peer consultation and see how the cases are actually worked up. And I think formulating pathology report and communicating with clinicians, trainees needs to be involved in this type of activities. And trainees should be constantly reminded to ask why and so what question during the evaluation so that they can understand what is the clinically significant information to be put in the pathology reports. So this, to sum it up, I think once a trainee has achieved a diagnostic competency, which I think is a basic foundation, we encourage refining the trainees' reporting skills, because without this type of mentoring and coaching, I think the junior pathologists may not be prepared and can be bogged down by some of the details of pathologic changes, and then they can lag in speed and struggle to complete the workload. And we want to make sure that the trainees who graduate come with the skills of reporting that offer clinically relevant information. So after discussing about pathology reporting and skills where trainees and both trainees and senior pathologists, they need to work in a collaborative fashion, the next category is challenge with administration. So some of keywords associated with administrative challenge includes billing, ICD coding, and CPT coding, and insurance reimbursement knowledge, navigating onboarding while adjusting to new practice, cost-effective patient care. And not too surprisingly, these were some of the comments made by those in non-academic settings, and they were more likely to experience these type of issues. And they had wished that they received some of this training and guidance in administrative activities. But the reality is that many of these administrative elements are actually learned on the job. So I guess, sink or swim type of mentality may play into some element. However, I think we can do something to help developing some of these skills before graduating. So for instance, I think faculty and training programs can add a rotation at a community practice if that's a possibility. And I'm sure many of our programs already have a management rotation where you are more exposed to the administrative side of the pathology practice. And as possibly a graduation gift course, we can provide a wealth management or some sort of financial courses to the graduating trainees. Meanwhile, I think the professional organization really needs to be involved as well, because maybe they can provide a targeted seminars, especially in spring or the summer, to those who are graduating, focusing on these administrative topics. Again, I think it really is a collaborative effort that are needed to tackle these challenges. So I find this website to be very helpful. When you go to the CAP website, there is a section called New in Practice Pathologist, and it has a lot of helpful resources. And so I encourage you as a junior pathologist, but also as a trainee who's getting ready to look out for jobs out there, to start familiarizing yourself with this website for additional resources. Now, so after discussing the pathology reporting skills, administrative challenges, the next challenge that was commented on was challenge with independence. So several participants commented about feeling nervous or lacking confidence in independent sign out during the early phase of their careers as junior pathologists. And I think all pathologists can remember like that nervous feeling of clicking the sign out button in one of the few first cases. And I still remember my first case was happened to be a prostate cancer. I don't even know. I think I should just done tubular adenoma, but I decided to sign out a prostate adenocarcinoma, and then of course it was sent to one of a prestigious institution in Maryland, and a famous pathologist read it, and thank God he agreed. But I just remember that feeling of signing out a first case. And I think the nervousness comes because of the legal concerns and some of the concerns about the clinical implications for patients. And among various factors, one important psychological concept that I want to highlight is imposter syndrome, which is a self-doubt of competency and fear of being exposed as frauds. And I think particularly in new environment and work settings, junior pathologists, regardless of their true skills and competency, they may experience some level of imposter syndrome that will undermine their abilities and have difficulty gaining independence. And some of the participants had mentioned about lack of sign-out privilege before graduation. And this is really an ongoing discussion among program directors. So, this is a directly brought from the ACGME Common Program requirements. Compared to training programs in other medical fields, pathology training seemed to involve a higher level of supervision with more restrictions on trainees' activities. So if you look at the level of supervision, there are three levels. So there's a direct supervision, indirect supervision, and oversight. By the end of the program, we would like our trainees to be at the level of oversight where the supervising attending is available to review procedures or encounters with feedback after care is delivered. But I think most of us as a faculty will agree, and even our fellows and graduating trainees, that many senior trainees may graduate without even fully reaching this oversight level. And it may be related to the legal responsibility and clinical implication, but to reach the oversight level, it means that the trainee may be reporting frozen results by themselves, and then the attending comes, or they may involve, releasing the preliminary pathology report, and then the attending reviews the case. And then I think this is a very unusual type of a setting. So the transition from this lack of sign-out privileges before graduating to work independently can be, shock to some newly graduating pathologists, and as survey participants have commented on. So how can we provide, opportunities to gain more independence? And, again, it's an ongoing discussion. So I think for junior pathologists, number one, being cognizant of psychological stress and concept of imposter syndrome is helpful. It just lets you know that rest assured that every one of us will experience a similar feeling, and then everyone overcome this phase at different time point. So trainees, those who are graduating, it's okay. We all feel that at the same time. And for faculty and senior pathologists, well, can we create an environment for trainees that stimulate a little bit more autonomous practice, including maybe senior trainees do a pretend sign out with junior pathologists, junior residents, functioning like a junior faculty. Can we have senior trainees supervise some of the autopsy cases of the junior residents? Can we have, the residents review frozen section slides before the attending pathologists arrive? And could we even take it further where if the trust in that competence level has reached, can we have senior residents call in some of those frozen cases even before the faculty show up? And I think even the simple act of allowing trainees to take the mouse and click the sign up button, I think in itself give them enough adrenaline to stimulate the condition of independent practice. And if the LIS system allows, can we use some sort of preliminary report options, allowing trainees to click a sign up button, but with the caveat in the claimer saying that it's to be reviewed by the senior faculty, and then maybe that will increase autonomy, or even give out some of the prelim results by email. So we've discussed the challenges regarding the pathology reporting skills, discussed the challenges regarding administration, and some of the challenges regarding independence that junior pathologists have experienced. The next category is challenge with mentorship and work-life balance. So regarding the mentorship, many junior pathologists felt that they did not get guidance during the transition phase and that the lack of dedicated mentor was a problem. Trainees and junior pathologists actually chose a mentorship, networking with mentorship, and friendship with colleagues as an important factor for choosing a training programs or institution they want to be at. So I think, this highlights the importance of mentorship and that the first few years of junior pathologist practice really will shape their outlook of confidence level, their reporting skills, and their practice overall. So I think it's very imperative that our pathology practice group take this transition period seriously and try to provide adequate mentoring. So to address these issues, to our trainees who are graduating looking for jobs or junior pathologists, we encourage them to first assess the culture of the practice when they're applying for jobs to ensure that the group is willing to nurture and mentor and that it is their priority this should be one of the priorities in selecting their first job. So in general, I think a diverse mix of pathologists at various stages of career indicate a healthy and stable practice. You don't want to necessarily go to a practice where everybody's a junior or everybody's a senior. So having that wide range group, it's really helpful. And then one potential problem that junior pathologists may encounter in real life workforce is this empty promises regarding partnership track or advancement up in the career ladder, especially in the non-academic setting. So I think to avoid disappointment, contract negotiation should be really emphasized for the graduating trainees to encourage and to learn about partnership agreements in writing. And of course, hope that practice leaders do not make these empty promises, but should the junior pathologist experience some of this disappointment, then finding the appropriate support system will help them navigating some of these difficult times. And so for faculty and senior pathologists, it will be important to serve as a mentor to guide the junior pathologists and also to excavate their hidden talents, such as leadership skills. So one suggestion of serving mentorship is to have some sort of a buddy system in which the junior pathologist may be assigned to a dedicated mentor for the first few months who can help with anything from diagnosis to administrative matters to using computer system. And the constant reassurance and empowerment through mentorship is really helpful. But mentors should be able to give a constructive and honest feedback as well. So even if it means uncomfortable conversation for both mentees and mentors, for the betterment of junior pathologists and for balanced mentoring, both empowerment and constructive feedback is needed. And regarding the work-life balance, some of the participants have commented that there's no time for vacation and there's no work-life balance. And possible factors may make it difficult for junior pathologists in both academic and non-academic setting. Could be the high case volume, turnaround time pressure, maybe lack of resources such as immunohistochemistry stains in some of the community practice, and maybe increased administrative activities. But interestingly, in our study specifically, only junior pathologists working in academic centers indicated work-life balance as a challenge. And we were trying to understand why. And academic pathologists may experience maybe disturbed work-life balance due to perhaps increased responsibilities other than case sign-out, such as participating in tumor boards, conferences, training education. So junior pathologists may feel that they should take advantage of the opportunities. So maybe they are forced to take on more new roles or new research. So maybe they just feel overwhelmed. And this could also be an indirect reflection of the hierarchical culture in academic setting, where expectation to cover the senior pathologist during major conferences or holidays could be problematic too, and that could cross the fine line between expecting less experienced pathologists to be a good team players and then abusing of the junior pathologist's vulnerability. So for our trainees and junior pathologists, we encourage our junior pathologists to realistically assess their capacity to take on the additional responsibilities and opportunities, especially when it comes to research. It's never, don't feel coerced to take on new projects, and it's okay to always say no. And for experienced senior pathologists, we encourage them to be mindful of junior pathologists of vulnerability that period, as the transition, it can be, that transition can be very delicate. And junior pathologists should be, encouraged to really, attend the conferences, establish social networks, and flourish and encourage their academic pursuit. So the last challenge to be discussed is professional identity formation. So what it means is that who are we in our professional setting? How do I want to be portrayed as? So as junior pathologists acclimate to their new work setting, they start to define who they are based on two major interaction groups. One is a clinical colleagues and the trainees. And depending on how they interact with this group of people, it will define their identity. So as noted in the keywords, participants commented that the environment change and dealing with unreasonable requests from surgeons or unreasonable expectations of turnaround time from the clinical team can be very frustrating. But it is important to note that pathology is a consultative medical field. This means establishing relationship with and gaining trust from clinical colleagues. It's unfortunate, it's a rite of passage. You just have to be trusted and just have to establish that relationship. So, interaction with clinical colleagues can be a source of stress and nervousness, but many of the scenarios can be handled with proper communication and display of confidence and calmness. And in some of these areas where the junior pathologist can shine is through email communication, being prepared for the tumor boards, or being confident at the interdepartmental conferences, and then showing calmness during intraoperative consultation. The second group that the junior pathologists will interact with the trainees, but particularly in the hospital-based practice where the training programs. So as noted by the survey participants' comment, the establishing accurate expectations of residents and fellow or working with a trainee itself could be a challenge, especially during that training phase. And we believe that's because a junior pathologist may struggle with some of the diagnostic uncertainties, and they may have underdeveloped mentoring and teaching skills during that phase. So we believe the junior pathologist can maximize the opportunities for transparency about their own vulnerability and focusing really on connecting with the trainees instead of hiding the vulnerability. They can serve as a role model by emphasizing on the importance of lifelong learning and working up complex cases together rather than just signing out case and then just kind of disappear into their office and then showing cases to the senior pathologists on their own. Try to involve the resident as part of this whole workup process. Show them that, we are all learning together and that peer-to-peer consultation is the real work and that behind the scene. And that by doing so, you are being truly a helpful mentor and being a role model for the trainees. And since the junior pathologists are not far from their own graduation, they can really empathize with the trainees by sharing tips on studying for boards and counseling trainings about career planning. And then they could really be the wellness liaison for trainees, encouraging them to speak up as needed. And, one thing to remember is that, the mean age group of our survey participants were 39 years old, some of them as old as 52. So those junior pathologists who are on the younger side of their age group, it's important to know that some of these trainees who come to your program may be older than you and may even had a full training back in their own home, their country or their hometown. So showing respect and understanding of this cultural diversity is very important. So in summary, I think the art of communication is an important skill that is often overlooked during the training programs. So for trainees and junior pathologists, active effort to improve communication skills is encouraged. Focus on transparency, share your vulnerability, that is fine, empathy, and then really try to connect with the trainees, and be cognizant of some of the cultural diversities. And for faculty and senior pathologists, they should make an effort to involve trainees in communicating with the clinicians, and that's how they start building their communication skills. So based on their appropriate trainee levels expertise, trainees can provide preliminary diagnosis by phone call or email, or report findings from the intraoperative consultation, review slides with their clinical colleagues, and actively participate in tumor boards and conferences. So now that we have discussed all these challenges, we do have a happier beat. Next two slides are brief discussion on other results, particularly the areas in which participants wish the training program had provided more guidance on. So for those who are in non-academic setting, they wish they had additional guidance in CPT coding, billing, and cost-effective patient care. Meanwhile, those in academic setting wish they had learned a little bit more about effective time management, importance of turnaround time, and tumor board conference and presentation skills. Other skills indicated by participants in both work settings included contract negotiation, recognizing pros and cons of various practice settings, so private versus community versus academic, and some of the financial tax preparation, and then budgeting skills. So again, some of the suggestion is, could we provide some sort of targeted seminars, whether it's through some sort of professional organization or local meetings, to provide additional resources. And when this topic was analyzed by gender, it was interesting to note that more female participants than male participants wish they had received more guidance in leadership and soft skills. Nowadays, there is a almost equal number of male to female going into medical school, but females are still underrepresented in the leadership program. I think given this disparity, increased institutional and departmental support will be helpful to excavate some of the unseen leadership potentials in women. We could try to positively encourage female colleagues to apply for leadership positions or introduce female trainee or colleagues at networking events, or encourage them to attend networking events. So, this study has some limitations due to, small number of participants, and only 2 academic centers were involved. But in the future, we aim to expand the data by including multiple centers and more participants. And although we cannot generalize the participants' statement and survey responses to all junior pathologists, we believe our participant cohorts were diverse and representing enough to better understand some of the junior pathologist challenges that they wanted to highlight. So we hope that this will initiate the discussion in improving training and transition experience for junior pathologists. So in conclusion, so for trainees and junior pathologists, it is crucial to get most of the training during their in the residency or fellowship program to improve on their diagnostic and reporting skills. And then it's important to also find a mentor who can provide guidance and support. So for junior pathologists, they should also actively engage in professional organizations and networking events to increase the opportunities. Because networking can lead to collaborative opportunities, and that means exposure to new ideas and potential career advancement. So for senior pathologists, we encourage them to serve as a mentor to help defining their career trajectory and really excavate their talents. Help navigating complex cases, offer advice on managing workloads, and provide emotional support during hard time. And then for professional organization, offer specific seminars tailored for junior pathologists. But the whole key part of this presentation is the mentorship. And I wanted to end this session by sharing my personal story on mentorship. And when I was a fellow at MD Anderson Cancer Center, I told Dr. Byoung, who was the program director back then, that I wanted to do a small study on junior pathologists. And with her mentorship, this small idea into a paper publication, and then eventually led to an invitation to share this lecture at ASAP in 2024 meeting. And now I'm here to spread the ideas to you at University of Minnesota. So, if mentorship and support can transform this small idea into something like this, imagine what junior pathologists and trainees can become with appropriate guidance and encouragement from the colleagues, senior pathologists, and professional organization. So today, it's really not just about academic exercise of how we can improve the overall experience of junior pathologists and trainees education, but it's really an invitation to collectively support the growth and development of the next generation of pathologists. So by understanding their journey, acknowledging their challenges, and actively working towards solution, I'm sure we can ensure that they are well prepared to meet the demands of their vital role in healthcare. So thank you for your attention, and I look forward to our continued discussion and collaboration on this important topic.
Wow, Dr. Kwon, thank you so much. That was a wonderful talk. And as a junior pathologist myself, I could see myself, just nodding my head, agreeing with everything that you've been saying so far. So very relatable talk personally for me. I do have a couple of questions for you, but I'm going to let anyone else from the audience ask their questions or share their comments first. And then I guess I can go last if there's some time.
Dr. Yogi. Hi, thanks for that talk. That was really fascinating. I'm no longer a junior mentor or junior faculty. I'm more of a senior faculty. But one of the things that I've noticed through the years that can be difficult with trainees, especially teaching them administrative or soft skills or leadership skills, is whether or not they think that's important. Right? Because I think a lot of times in training, they are so focused on learning the pathology entities and learning the microscope and learning that they they don't take the time to dedicate to some of those administrative skills. And it is somewhat trainee dependent, right? Some trainees will be a little more open to that than others. But do you have any thoughts for how we can get trainees to understand the importance of some of these other areas other than just learning, the pathology under the microscope, or the sign out, or the that sort of thing?
Excellent question. And that is partly the reason why I wanted to share this talk with you, and hopefully we have some trainees logged in here, is that having a upfront conversation about this is that the reality is you'll be practicing as an independent pathologist later on, and that this type of skills will be crucial. So having this type of talk in itself, I think, already elicits some of these concepts in their minds. So that's why I was addressing this talk to you as a trainee specifically as well, that listen, this is what's about to come. But second thing is, I think having them involved more in the behind scene type of work. I'm not sure how your work setting is like at your institution, but sometimes I find that even at Georgetown, we would sit in the sign-out microscope, and then that's it. Like our relationship ends there. But that's just the beginning, right? So we bring those cases, and then we share, and then we get emails from clinical colleagues. Like, how do I even email back to them? Or the conferences, they ask difficult questions. So I think having them involved in this real life work setting, especially once they reach the diagnostic competency by PGY 2 and 3-ish, I think that will be really helpful. So just expose them more to our real life work setting, and share our vulnerability, and share the difficulty that we as a faculty is facing.
Oh, that's great. I think, I sign out heme path and molecular, and in heme path, generally for residents, we go through every case together. I go through the report with them. They see the changes I make. I discuss why I made those changes as well. And we also have a consensus conference, both in AP and in heme path. In heme path, we do it 4 times a week, basically, where we bring cases of interest, difficult cases, etc., in addition to one-on-one consultations. So, but the trainees get to see that consensus conference piece about what questions are being brought, what questions there specifically are, and then what people's opinions on it are. So,
that's perfect. And sometimes it's faculty dependent too. So hopefully, talk like this have elicited some of the thoughts on some of the faculty, and see how they can also change their workflow to optimize the training as well. Thank you.
And Dr. Crossan.
Yeah, thank you very much for that talk. I'm not a junior pathologist either. And actually, as I look back on my career, I think I probably was a pathologist for maybe 25 years or so before I really realized what I should be doing. But what I want to thank you so much for was your emphasis throughout the talk on direct communication with clinicians. I have been residency director for many, many years, and I always tell the new residents coming in that they are physicians first and their specialists second. And that making a diagnosis for a patient is the most important thing you can do in their career, in their illness. And a lot of direct communication and phone calls to clinicians is extremely important. And I'm not sure, particularly in academic settings, that the residents really appreciate that. And sometimes I hear from the residents that they're kind of afraid to call the clinicians. How do you propose getting over that?
Sink or swim. No, I'm just kidding. No, I think that's an excellent point, because I feel like many of us have this misunderstanding that we're just kind of sitting behind a microscope and we don't talk to anybody, and that's not true. I think 80% of our work is about talking, communicating, and emailing. So I think early exposure is a key, number one, and making it by exposing them early as PGY1 or as soon as they come into the training program. I think that would set the tone of the program and the expectation. I think that really is the key. And again, I think that really requires collective effort from all the faculty. You can't just have a select faculty doing certain things and the rest not doing that. So it's a really institutional culture that will drive encouragement of the trainees to be participating in communication with the clinical colleagues. So early exposure and institutional culture, that this is what you do. Now you are a physician, you're not just a machine looking at the slides. Your work really is about managing the patient care at the end, and how do you do that is by communicating with your colleagues and then relay the messages. So that'll be on my but not even 2 cents, 1 penny idea.
Amazing. I just wanted to share a quick story that I had with Dr. Kwon. Among the slides, you said, just allowing the trainee to click the verify or the sign out button on the pathology report is something that you could do. And I have to admit, I was one of Dr. Kwon's victims of that. I was signing out, I think it was a Crohn's luminal GI biopsy. And then, I had previewed my cases. I brought it up to Dr. Kwon, and then she's like, okay, this looks about right. And then she gave me the mouse, and I was like, oh my God, what do I do now? And then she said, yeah, I mean, you looked at it, please sign it out. And I was like, you know what? Can I look at it one more time? And I spent the next 30 minutes re-reviewing all of the slides just to make sure that I wasn't missing a single neutrophil here or there. So I think that, that brought me back memories. But my question to you, Dr. Kwon, is, during your transition to a faculty member at Georgetown, what kind of support did you receive from the department? What do you think worked and helped you? What do you think didn't work, didn't help you at all? And now with your current role at Georgetown, what kind of changes are you implementing to help the trainees and junior faculties that might go through the same?
Oh, excellent question, Dr. Park. So a full disclaimer is that I did train at Georgetown, did residency and fellowship. So I think my transition might be a little bit different than those who's coming from the outside, because I had been already accustomed to the system. So it was relatively a softer landing for me. But I must say that having one good mentor, and that's Dr. Curry that you had mentioned, he's kind of almost like a father figurehead who took me under his wing. And he's a straight up a good guy, but very bold, and then would give me constructive feedback to negative things to positive things. And that to me was really helpful. Sometimes our generation, I feel like, are a little bit sensitive, especially this generation. They feel like everything needs to be in positive and rosy color, and I don't think that's true. We're physicians. We're in residency program. We are here for the betterment of everyone, including patient care. So it's okay for faculty to be honest and then transparent and have some of this uncomfortable conversation. But I'm sure there are ways to do it, and these are some of the soft skills that I'm also learning to develop to give constructive feedback. So as a faculty transitioning, receiving constructive negative feedback to me was helpful, not just about praising and positive things. Our department is small. Yours is more than 80 faculty there, but our department is under 20 faculty. So I don't think buddy system is necessary per se, because we're such a small system. So we did not really necessarily establish that, but we do try to pair up a mini buddy system. So for instance, Dr. Yannis Dimopoulos, who is the newest recruit, he was paired up again with Dr. Curry, because he also does hematopathology. So any difficult cases or some of the concerns, he was asked to go to Dr. Curry as a first line. So I think having a little bit of that mini pair up will make it official and make them feel a little bit comfortable transitioning. And this was implemented by our chair. She's the one who assigned our new recruit to go to this particular senior pathologist. So I think this direct communication of pairing up a transitioning JP to senior pathologist is really helpful. What didn't work? I think so far things worked out pretty good. So I don't really have much comment on that. Yeah.
Okay, we're going to take our last question from Ishmael. We do have a quality report at 9 a.m. So go ahead.
Thank you. That was wonderful presentation. I just had maybe you covered that, we slipped my mind. I was wondering what constitutes a good mentor for, in terms of like, do you, I don't know if you're, for a junior pathologist and also like from a junior pathologist to a resident, what would be the qualities or the traits that you think, like for instance, part of me when I'm signing out with the residents, I'm very, like if I'm signing out for a case and the diagnosis is the same and I'm writing it in a certain way, I try to not change much. I mean, if it's the same diagnosis, I mean, of course, if it's different, I'm gonna have to change it. But the same diagnosis, I do not change much. So I was wondering, what do you think is a good mentorship to have in order to be a good mentor for junior pathologists and for residents?
Excellent question. And you know what? That is actually part 2 of our research that we were working on, that we sent out a survey trying to see how can we, what does it mean by having a good mentor? So hopefully, the resident who was involved in will finally publish the paper at some point. I need to get back on that. But I think a good mentor is somebody who can first be adaptable to the personality of the different trainees and the junior pathologists. So every trainees are different. So I mean, it is more work on us to do that, but kind of analyzing number one first, what kind of person this person is and what works and what doesn't work. That analysis, I think, is kind of the key to connecting with them first. If this person is pretty resilient and then doesn't mind like harsh comment, not harsh comment, but more upfront comments, like go ahead with that. But if this person is a little bit more sensitive and tend to be vulnerable, then we might want to tailor the way we provide the feedback. So analyzing the person is number one, the key to being a good mentor. And then second thing is, I think, transparency again. Sometimes we feel bad changing things, but changing comments or changing reporting skills. But I think it's important to be transparent and let them know what is right, what is not right, what is optimal, and what is suboptimal. So I think that transparency really is kind of the key to be a good mentor, and then give them the feedback that they need. So learning the skills of feedback, I think, is a skill that good mentors should have.
I will tell you one thing that I'll keep it quick and short since we only have 1 minute. One thing that I had during my residency, which it's like having a mentor. Like as a resident, you have to be paired with a mentor, which I felt like they were just checking lists, because if I had seen that mentor in Target outside of residency, he wouldn't know me, I wouldn't know him.
Oh.
So that's, I think as well, like it's not just having, we're having mentorship is a good thing. No, actually it has to work. Like meeting every 6 months or 7 months, I don't think actually that pays off, and perhaps that's something you could use. I mean, that's my personal experience. But
yeah, no, I mean, that is an excellent point. And I think that's why, the first comment about analyzing the trainee, in order to be even analyze a trainee, I think you have to know the person well enough to see what works for them. That means, making that connection and then learn their personality, what works, observe them. So that is even the beginning of even being a mentor, so that you bring an excellent point of this, useless, the labeled mentorship. That's not going to help.
Thank you. That was excellent. Thank you.
Dr. Kwon, that was amazing.
Thank you. I appreciate it. And I hope everyone has a great Thanksgiving, and talk to you all soon.